lot in a clinic is, oh, my mom had a bad back, so I'm going to have a bad back. Is that true?
There's some level of truth to it. The joke we always tell when they say is, what can I do to make this back pain not happen, or what can my kids do, is we say, well, be more careful when you're picking your parents. Because there is some level to truth about the genetics of it. We think that that's more related to the alignment of the facet joints, which are the joints in the back. Maybe they're tilted a little one way or more in your family line. Same thing with like knee arthritis, that maybe the joints just shaped a little bit different. And we know that different groups of people from different parts of the world have different anatomy that might predispose them to some of those problems. So this is the nature versus nurture argument, is that there's the people that will say, well, to give the knee as an example, because everyone can relate to that, someone will say, well, I played running back in high school and so I have bad knees. Well, maybe, but maybe you just have bad knees because you have bad knees. And there are obviously examples if they say, yeah, well, I dislocated my knee 3 times. Okay, well then that's probably true. But most of the time, people that have bad knees, they just also happen to have played football, and it's unrelated. With the back pain and back problems are so common that it's also likely that you just happen to have back pain like your mom did. Mm-hmm. The problem that we run into is something that I end up having to unwind a lot is back pain, symptoms from back pain, back surgeries are all so different. It's not like saying my uncle got a knee replacement and then he's getting a knee replacement. Those might be very, very similar. But when someone says, oh, I'm not having back surgery because my mom had that and now she's in a wheelchair, well, she had it 40 years ago and she had a 10-level fusion, and I'm telling you that you need a discectomy, those are very different things.
Right.
And so they might say, yes, she had a back problem and I have a back problem. The back is, think of the back as 26 knee joints, right? Like it's just a bunch of different things going on. So where you have a problem, to what degree that is, there's probably some genetic component, but I certainly wouldn't, if you're in your 20s and you see that your dad's getting back surgery, I wouldn't think, well, great, I'm going to get back surgery. Like it's probably not a lot more likely than the general population.
Got it. Okay. Because I know that's fearful for a lot of people.
Absolutely. Absolutely.